Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones. Hey there, thanks for listening to Raw Remedies podcast. Let me start out by introducing this week's guest, Dr. Betsy Redmond. Dr. Betsy is a co-founder and chief scientific officer at Innovative Pet Labs and a leading expert in nutrition, diagnostics, and lab innovation. She holds a PhD in nutrition and specializes in GI health, having worked in research, education, and novel testing methods for people. When her dog, Linda, struggled with chronic gastric issues that mirrored those of her human patients, Dr. Redmond realized if she could test Linda's gut health using the same advanced methods employed for humans, then she could identify the right diet, supplements, and lifestyle changes to help Linda live a longer and healthier life. Thus, Innovative Pet Labs was born. On today's episode, you'll learn about the different tests they offer, what each one is for, and how they might be able to help shine light on the true underlying cause of chronic conditions our pets face every day. Enjoy. All right, everybody, and we are back. And of course, I want to start out by saying a big thank you to you, Dr. Redmond, for coming on today and taking time out of your schedule. I really, really appreciate it.
No problem. I'm excited.
I know this is going to be a great conversation. And I think just to start out, so, I work in the human healthcare realm. And so as a fellow human healthcare practitioner, now also doing work in the animal realm, I would love to hear a little bit about how and why you ended up pioneering this company in the pet space.
Yeah, so I worked for a lab and helped start one of the first GI microbiome tests with a company called Metametrics. It's been taken over. But so I was well aware of that. And what I did was I did a lot of education and I talked to clinicians and we did some research. But when my own dog got sick, I'm like, wait a second, she's a mammal. Why can't we do this on her? She had what the vet referred to as a blossoming anus. And so it's as bad as the description sounds. And so, we wanted to do something. And I thought, why can't I just do the test? But we didn't have, reference ranges. But when you start looking, a lot of the tests originally were done in pets, a lot of beagles and rats and mice. Yeah. And then they moved to humans. And so it's like, why can't we move back? A lot of them are going to represent the same thing. Just like you can have a dog that can get diabetes, you can have a dog with IBD, with inflammatory bowel disease.
Yeah.
So, there's a few differences, but really they're mammals. So we got together, our dog-loving coworkers at the lab, and we decided to start doing this in pets.
And I'm sure there were many dog lovers at the lab.
There were lots, yeah. And there's, and it's easy to do in stool. We also wanted something that, we're really like direct to consumer. You can do it at home. Certainly vets can do the test too, but we sell direct to consumer. So our tests aren't necessarily diagnostic. We're not going to say your pet has this. They're just giving you an idea on kind of the function and status of the gut.
Yeah. So, we're seeing this result and it could be indicative of this problem, or this suggests that maybe there could be an issue here. You should look into it further. I love that. And I love that you do direct to consumer, because I think there's so many pet parents who really want to be empowered. And that's not always easy to do if you have to do everything through your veterinarian, especially because there are not nearly enough holistic or integrative vets in the community compared to how many pet parents want to work with one. So.
Right. Yeah. We go to a lot of vet conferences. I was surprised at how many of those conferences have lectures on how to sell your practice. So they're just becoming more corporate. So they're just getting bigger.
So gut microbiome is huge in our house. And it's, in nutrition and gut health and, leaky gut. And there's just so many, I think, aspects of health that are so closely tied to gut health overall. And so I think that this is probably my favorite topic to talk about ever, is anything gut, really. Which is why I feel like, today's conversation is something that is just very applicable to every pet parent out there, because like I said, gut health is tied to so many aspects of health. But nutrition and gut health really go hand in hand for me. And so your doctorate in nutrition probably played a role in empowering you to be able to apply what we've known for so long about gut health in people toward, for me, what should be obvious for our pets. So what are your thoughts about how diet and nutrition really impact our gut health?
Well, 70% of the immune system is in the gut. And it's not just the bacteria aren't there and then just they're there and that's great, like they're taking up space. They're very active. So they make a lot of compounds. So, and those compounds are going to impact things. And there's that whole connection with, the vagal nerve and your gut and your brain. And so things that happen in the gut don't necessarily happen in the brain, but they can signal things to happen in the brain. And then the overall immune system. But all that's going to be impacted by what those bacteria are producing. And so the bacteria produce things that it depends on what bacteria are there and what they're exposed to. I always thought, for years I gave my dogs this dog food. They eat dog food.
Right, yeah, dog
and
food.
Then
Yep.
And then, I started giving them can I give them, my dog, Linda, that was the dog who had the bluffmening, who lived to be almost 18. So,
Yes.
Yeah, we like to say she's in college. She left for college. But she loved fruits and vegetables. And at first it was like, can I give her a carrot? Can I give her, a blueberry? Can I give her kale? She just loved all that. She loved red peppers. Like she liked all that stuff. But those, so it's fiber that pets need. So in their gut. And they may not need the same amount. That's going to be somewhat dependent on the pet. But it's also polyphenols. So those are those compounds in fruits and vegetables that give them the color. So bacteria act on those, and different bacteria will act on it and make different compounds. So, and those can affect a lot of things. So we're not necessarily looking at those compounds. We're looking more at markers that are going to be impacted by those or can impact those. So we look at a marker that looks at inflammation. But if you have a lot of gut inflammation, that's going to change the bacteria composition, because some bacteria do well in that situation. Like, I love this inflammation. And then the compounds they make, are going to change.
And then you get that kind of positive feedback loop going forward. If you have inflammation, which is a good environment for bacteria who thrive and promote inflammation, then they proliferate. It's going to cause more inflammation. And it's just this cycle that continues and can make things worse and worse. Which is why I think it's so beneficial to be able to have tests like these so that you can have those questions answered and say, you don't have x-ray vision, you can't see through and see what your dog's or cat's gut is doing. And I love the ability to be able to just get that sample, check those biomarkers, and then have a little bit of an idea of what that underlying gut environment looks like.
Right. A lot of times we get a lot of people whose pets, they spend a lot of money on food and care for their pet, and they just want to make sure what I'm doing is working. So just like people, there's not one perfect diet for every pet. There's not, for every person, there's a lot to do with besides your preferences, your genetics and how you metabolize. So finding out, is this working for my pet? And just like people, you don't just one day develop bowel disease or have suddenly I can't digest, my pancreas stopped working. That's not just an overnight thing. There are things that happen, and so some of those we can catch.
Yeah, the slow burn. And I hear that all the time in the hospital, especially in the emergency room. People come in and they're like, well, I was fine until I wasn't, or I was healthy until I was sick. Or they come in and they come in for a problem, and I go, do you have any medical problems? And they go, no. And I say, when's the last time you saw a doctor? I don't know, 25 years ago. And it's and
you
so,
could have been
I
progressing,
agree.
Yeah.
Having the ability to just take a snapshot, look and see, be proactive. And in terms of chronic issues, unfortunately, it seems like its own pandemic now is how many pets are experiencing chronic GI issues. And I think this has been a slow burn for a really long time. I mean, really decades of things just kind of overall getting worse for animal nutrition in the form of, quote, dog food. And it's frustrating that so many different underlying problems, I think, can present in a similar manner, right? Recurrent diarrhea or vomiting or lip licking. Well, maybe it's GERD, or maybe it is EPI, or maybe you have IBS, or maybe you have leaky gut. So there's a lot of things that can look very similar, and that can make you want to pull your hair out when you're trying to figure out what's going on. So can you tell us about how the IPL testing can help pet parents take away the guesswork and maybe start pointing them down the right path on where to look?
Yeah, so it kind of helps you see what area, and we usually tell people to do the comprehensive. That's like the blue box.
And I'll show you too. That's what I have here. So if you're listening, I'm holding up their comprehensive test. It's a big blue rectangle, and it has all the stuff inside of it. I won't open it up because I'm going to probably use it soon, so I don't want to unseal all of the packaging. But yeah, we'll talk about this test for sure.
Yeah, so it does like 6 different markers, but then you can follow up in specific areas. Like it may just be one area. So we have 2 of the markers that kind of work together are calprotectant and secretory IgA. So that's also in a separate test that's just inflammation and immunity. And calprotectant is a great marker. People use it, and you can use it cats and dogs. We've done some zoo animals, which is kind of fun. But calprotectant is a marker that gets made when neutrophils or white blood cells infiltrate the gut lining. And so in people and in pets, they've looked at the fecal level of calprotectant, and they've correlated that directly with biopsies, like they've gone in and taken a biopsy or just done a scope. But getting a fecal sample is much less invasive than a biopsy or a scope. So if that were super high and your pet had been losing a bunch of weight, and we say that too, like if that marker comes back high and there's these alarm type symptoms, you should go to your vet. Like that's not an at-home thing. But for most pets, you may just have a little bit of inflammation. You can treat with some anti-inflammatory supplements or changing diets. So it's just an easier way to assess that. There are also pets that have bowel disease and their vets have been following them. But instead of doing a scope when they start to feel bad to see, you can just every 6 months or every year just do the fecal calprotectant to see the level of inflammation.
Yeah, and that's nice, especially if you're going to do repeat levels, because you don't want to put your pet through anesthesia each time. Doing a scope is invasive. There is, risk associated with even something endoscopic, right, where they go up the nose, or maybe they're doing a colonoscopy, which goes up the anus. And so, but it's invasive, and there's risks involved. And there's always risk involved with anesthesia administration, especially as animals get older. So I love the ability to be able to have something that is not invasive, literally just a stool sample, and you can send that off a few times a year and be able to track your markers.
Yeah, and then we also look at secretory IgA. And IgA is immunoglobulin A. There's several. IgE is a true allergy. But secretory IgA is an immunoglobulin that gets released at the gut lining, so mucous membranes. And so in the stool, it's looking at, it's considered the first line of defense at the gut lining. So it's in general, it tends to be good friends with the commensal bacteria or the good bacteria. So it gets made and it comes out, and so usually it rises and falls with the gut bacteria. So it can kind of give you an idea. But it will, it can jump up when it sees a parasite or a pathogen or a virus or has, reactions to foods. It can jump way up. It can also go down if it's been fighting something for a long time. So, generally, I'd rather see higher than lower. Higher is what it's supposed to do. It sees something that's going to react, and usually it'll come down on its own. But lower is kind of I can't pull it out.
So if it's lower, what does that mean, really?
It means there's an inability to respond. I mean, it could mean that there's super low commensal bacteria. That is one thing that it could mean. The bacteria is just really low. In human tests, when we look at, all the different types of commensal bacteria and secretory IgA, they tend to go low together. There's a product called Immunolin, and it's plasma bovine immunoglobulin. That's been really helpful in people, and they do have I think Adored Beast. There is a company that has it for dogs. It does,
Yeah,
and
I think it is Adored Beast.
Yeah. So, they've done a lot of testing in pets. I mean, I contacted the company, that makes the main product, not the supplement company. And like, do you have a lot of testing in dogs and cats? And they said they did. And so then I was surprised that they brought that out because it's a good product. It can help support it. It will help increase secretory IgA, but it also helps with loose stools to kind of, bring that back. Saccharomyces boulardii is another one that kind of brings it up. It kind of works, and both of them are good for loose stools. So if you had a dog who's super constipated, you may want to, hold off on that. But the Saccharomyces boulardii partly works by like, hey, I'm a yeast and I'm here, and then your immune system jumps up, and then it turns out, oh, you're a friendly yeast.
Yeah. I just recommended some S. boulardii to actually a friend of mine who has been having some GI issues after she had her baby. I ended up having to get penicillin for 24 hours, like a straight 24 hours in the hospital. And she's been having some GI issues since. So she's been on a probiotic, but hasn't been feeling quite like herself. And I said, well, maybe we need to pair that with some S. boulardii and see if we can help rebalance things. I wonder if you might have a bit of a yeast overgrowth because perhaps the levels of your commensal bacteria, good bacteria, are lower because you took the penicillin. We're trying to replenish that, but that's not really doing anything for maybe some yeast that could have grown out of control. So beneficial but competitive yeast using the S. boulardii, I'm hoping might help her symptoms. So we'll see.
Yeah. Right. And they do have some studies out now that people who go on high dose probiotics after antibiotics take a little bit longer to get to baseline, and that you should support some of those probiotics with prebiotics, because the probiotics use a lot of the resources that your own gut bacteria use. And so it's helpful to give them some fibers and polyphenols. So, and all those things can work in pets. So, we're looking, back to like inflammation and immunity. We look at calprotectant. And even in the research, they'll say, in more conventional research, the first thing you should do is try diet. And a lot of times they'll say like hydrolyzed protein, all processed diet.
I know.
But sometimes just going to, changing to a less processed food or a homemade food, or gently cooked, just something, different, and getting a straight protein source. So some pet foods will have all different types of proteins, chicken or beef, and like trying to figure out, try some fish, try rabbit, try different things. My dog has ended up on a cricket protein and he's doing great.
Interesting. Yeah, that's been coming out information about that lately. I've been wanting to look into that. Actually, a friend of mine asked me to do a podcast. I do a combination of cricket and grub. Yeah, that's so interesting. I think we're going to see a lot more of that happening lately. I'm very interested to see what Super Zoo looks like this year, because I have a feeling we're going to see some brands coming out with insect protein.
Yeah. So, but that's like one of the first things you can do is change diet. And then in conventional, they'll say that if that doesn't work, then try some antibiotics and then go on some, those high dose steroid type medications. I think that just trying one also, depending on the level, probably trying, different. It may not be the very first one. You may have to backtrack it to less and less processed.
Right. There's a lot of different options out there. Thankfully, the fresh food community has really grown over the years, and you have raw options, you have cooked options, you have freeze-dried, air-dried, dehydrated. There's a lot out there. There's very novel proteins. Some companies do kangaroo, alligator. There's all kinds of stuff out there. Right. So certainly there's options for everyone. So we've talked about the calprotectin, we talked about the secretory IgA, and I think there's 3 more that you test, or
There's
maybe
4 more.
4 more, okay.
So there is like the digestion and detox, which looks at elastase, so pancreatic elastase 1, which gives an idea about digestion, and then beta-glucuronidase, which is an enzyme. So the elastase it's a proteolytic enzyme. So that's an enzyme that digests protein. And it gets secreted along with lipase, which digests fats, and amylases that digest carbohydrates. So they all get, secreted at the same time. Elastase is a little more stable, so they use it for kind of overall pancreatic function. And there is like pancreatic insufficiency, exocrine pancreatic insufficiency, EPI, and then pancreatitis. And so the marker we're looking at is elastase. So elastase is going to go low in dogs that would go on to get pancreatic insufficiency or pancreatitis, but not all the dogs who have low are going to go on to develop something more serious. In people, they've started to propose why don't we have like a suboptimal pancreatic function? Like they're trying, coming up with some wording for it, but it's not that suddenly you have it and it's totally working or then you don't. So some pets do great. We had a vet who tested her dog and it was older and they realized it was low and their pet didn't have a lot of symptoms, but she just kind of took things for aging. And then when she gave them some digestive enzyme, they put on a little bit of weight and were doing better.
Yep. So they were able to better digest so that they can better absorb those nutrients, because if you're not breaking it down to its smallest form, then you're not going to be able to absorb them at the cellular level and you're just pooping out what you fed them.
Right. And I think if you get undigested food in the gut, then you're feeding bacteria stuff that they normally wouldn't get. So you might grow an imbalance of the gut bacteria.
Right. Yep. Lead to dysbiosis.
The other marker we look at is Beta-Glucuronidase.
That one's one of my favorites. I think Beta-Glucuronidase, it's so cool.
It's so interesting. Yeah. So generally, like in people, we're going to secrete, we make it, dogs make, everybody makes Beta-Glucuronidase. And it is partly for breaking down some carbohydrates, some porphyrins. So you don't need much. So mammals just make a little bit. So if it's really elevated, it's likely coming from gut bacteria. So it just being high is identifying, hey, there's probably some imbalance there.
So I'm so curious for pets if it's a little bit different for our dogs and cats. So for people, if you have more plant protein, you're eating a lot of good plant fiber, you're going to have lower beta-glucuronidase levels. And then the opposite, if you're not getting enough fiber in the diet, if you don't have enough good plants in the diet that are going to help with digestion and feed the good bacteria, then you have higher beta-glucuronidase levels. For dogs, if you have a high level, or cats, if you have a higher level, indicating that there could be some dysbiosis present, what action would you take for that?
I might think about supporting good gut bacteria. So because dogs aren't, and we set a reference range based on normal healthy dogs. So even in people, setting reference range, and this is just all labs, it's pretty rare to get a marker where we're going to be like, we're going to separate people by male and female, overweight, underweight, a vegan diet, high fiber, keto. Like they don't separate those, and a lot of times they may make a difference. It may not be substantial, but so with pets, we set a reference range based on normal healthy pets. So if they're really high, and we're also tracking this data to see, does breed and size make a difference? Because in some of these markers, it may make a difference.
Okay.
But it's not totally clear. So we think about then supporting the good commensal bacteria that are there. Getting some probiotics, getting some, prebiotics. A lot of times starting with polyphenols is a little bit easier than adding fibers. So they may have fewer symptoms. And it may be, we talk about that. It may be as easy as adding some, produce toppers on things. It just depends on where they are. But I always like beta-glucuronidase because it has that double, like that two double thing. Like beta-glucuronidase, if it's really elevated, there may be an imbalance. There may be some dysbiosis, but also it interferes with detoxification. So it will grab glucuronide molecules, and a glucuronide molecule is, so in the liver, there's a phase 2 detox called glucuronidation, and it will grab toxins or hormones, and it, essentially grabs them, puts this glucuronide molecule on them, and then sends them in the stool, and like, get on out of here. So it's handcuffed, it's leaving, and then beta-glucuronidase was like, ooh, I love that glucuronide molecule, I'm gonna grab it. So it grabs it, and then the toxin and the hormone's free, and they're like, oh, and they might get excreted, but they might just get reabsorbed. So sometimes that can also impact that, phase 2 detox. So we also think when it's high, like make sure don't have your dog walking through just sprayed grass, or look at the level of, if there's secondhand smoke, or all those kind of things you would do for yourself.
Yeah, all of the things that you're thinking about that can overburden your detox pathways. I mean, we don't think nothing is black and white when it comes to markers like this, right? So we need a little bit of beta-glucuronidase, right? We need it for circulation of your thyroid hormones and the estrogens, right? And vitamin D. And so you still there should be some floating around. It's just that when the levels get high, it should make you question, why is this happening? So not only can we fix the underlying problem, but also, what is this impacting now that it's high? And I know that in people, especially women, high levels can be associated with an increased risk of malignancy. In particular, there's a risk of breast cancer, right? Because high levels mean that you're not excreting your estrogen appropriately.
Right. So they're just getting reabsorbed. So you're just concentrating those levels. Yeah.
Science is cool. Oh my gosh. All right. So that's 4 of 6. What are the other 2?
That's 4. So the other 2, there's 2, and then there's actually one more that's not part of that kit. But is zonulin and fecal antigliadin. Fecal antigliadin is just like within your gut. Is there an issue with a response to gluten? It's not a celiac test. It's not an allergy. It's just kind of an immune reaction.
I did that on myself, actually. Not through you. I did it through Function Health, but I did it because I thought that I might have a gluten sensitivity, not celiac, just sensitivity, because I've been having some thyroid antibodies. And I thought, maybe it's not actually thyroid. Maybe I have an issue with gliadin and my body's confusing things because they look very similar. Turns out that I had a normal level, so I can't blame it on gluten. I have to blame it on other things.
Yeah, but I think it's good to look for those things because that's a simple thing to do. Yeah, I mean, certainly in people, it's an IgA antigliadin. So in pets, if they have a high reaction, sometimes we see it that, if you're having this reaction because you're having all this stuff go on in the gut, and it's just like everything's bothering me, and even that gluten. So it may be that if you heal things up, you wouldn't have this gluten response. I mean, that's not really been established. And in people, there's 2 IgAs. There's IgA1, IgA2. In the distal colon, it's predominantly IgA2. In some reports, that doesn't necessarily correlate so strongly with IgA1, which is in the blood. Rabbits have 11 type of IgA, which I thought was so interesting.
God,
dogs just have 1.
So many.
What's the point of that? Rabbits are so fascinating. And they ovulate during intercourse. That's why they're always getting pregnant.
Yeah, rabbits are unique creatures.
Just a little fun rabbit fact. But so, that's just, that test is are you responding to gluten? Are you having a reaction? And then along with that is zonulin. So zonulin is a marker that gets secreted, and it's known to interfere with tight junctions. So the enterocytes, the cells get held together, and there's tight junctions that hold them together, and zonulin can pull them apart. So it makes it harder for the gut lining to really regulate who's coming in and out, especially if there's also inflammation.
Those levels can be nice, I think, because so many pet parents are experiencing leaky gut symptoms with their pets. And so I think that can really point you toward, do we need to go hard down the pathway of targeting and trying to overcome leaky gut, or do we not focus on that quite so much and pull back and look at maybe something a little bit more specific?
Right. Yeah. I mean, and so gluten can trigger zonulin. So even in people who don't have, like in people, if they don't have a gluten response, Fasano, who actually discovered zonulin, was saying that anybody who just ate a whole pizza would have an increase in zonulin. That's just, going to happen. But certain gut bacteria can also secrete it. It is associated with more. In people, increased intestinal permeability or leaky gut is also associated with smoking and NSAIDs and alcohol. I mean, dogs can take an NSAID form. They could be exposed to secondhand smoke. So thinking of those things too.
Curious, what about, I wonder, does the amount of alcohol would impact the level of potentially zonulin increase and risk of permeability.
I limit my dog's alcohol,
Yeah.
so I think.
Well, I'm just thinking like alcohol in tinctures sometimes, right? Like, so
Oh, right.
you may have dogs on like
I
several
think
different
certainly it
tinctures.
is.
Yeah. So
I
probably
know
small
when
amount.
Yeah.
I used to think about alcohol and risk factors in terms of, obviously in terms of addiction, right? Because I see a lot of people with that, but in terms of, gut health and vitamin mineral absorption, something that I never used to think about before was detox pathways and risk of cancer. And it's really come full circle for me because when I was in college getting my master's for my NP, my thesis was actually about breast cancer and identifying women's understanding of the risks associated with development of breast cancer. And one of the things on my questionnaire was alcohol consumption. And I never knew why. I just knew I knew it was a reason, but I didn't know why it was a reason. Now that I know that it impacts actually several of your phase 2 detoxification pathways, now I understand why that can be the case. So I think it's funny. It's been 12 years. It's been so long.
It can significantly impact the enterocytes themselves.
Mm-hmm. Yeah.
So people who drink a lot may have to go to the bathroom in the morning, and that's partly, sloughing some of that stuff off. So
lots of reasons not to drink.
Yeah, I mean, I think during the pandemic, we certainly saw a lot of people drinking.
We saw a lot of reasons to drink.
Right. I mean, I'm not denying its effectiveness.
Yeah, that's true. I didn't have time to drink. I was too busy working 8 million hours a month.
Oh, yeah. No, I was just cloistered doing research, so it was nice in that respect. And then I was going to say the last marker we do is fecal cortisol. So we look.
I didn't know that you guys had that one. Okay.
We just started that because, you can look at cortisol in blood or salivary. And blood is like, what's your cortisol level right now? Mm-hmm. And salivary is pretty close to that. And so we liked stool because it kind of gives like a week or so average of what your cortisol is. Kind of like a glucose and a little A1C. Because I don't need to know what if you did the test right when, the UPS driver was driving by and your dog freaks out.
Right.
So
that's our house for sure.
Yeah. So it's like, with a stool, it gets more of an average. And hair was also hair's a longer term, but hair in the research can be impacted by hair color, which was interesting. So white or black hair kind of impacted how much cortisol they would see. And then, it's more exposed to the elements. Yeah. So certain things can impact it. So we like it to see, kind of what's happening. I had, when we developed it, I don't think it's been a year yet, but I had just gotten a foster dog who was crazy. And it was like, you can return him, but he'll probably get euthanized. And it's like, I'm not going to return him.
Yeah.
So we've really been working on it, and his was higher, and then it's really come down. So it's like, okay, just calm down. And really, he just needed a place that was his own,
Yeah. The cortisol levels, when you are testing them, I really wish that there was actually a way for pet parents to be able to test salivary cortisol. As far as I'm aware, I don't know if you can do that. For people you can, and a lot of functional practitioners will ask people to do that if they're trying to look at cortisol curve. Mm-hmm,
yeah. So
but I don't think we have that for pets. And it's too bad because you think about going to the vet, it's a stressful place. Maybe your dog's afraid of the car. Maybe your cat gets car sick, and then good God, if you've ever tried to get blood work from a cat, I mean, it takes the entire office staff to hold them into position before you get the needle in them. Of course, their cortisol is going to be high. So I like the idea of being able to get something that's more of an average. That's the one that you have on your website, a stress test, right?
Right. And I think also, I mean, we were surprised when we started the company. We started, as a dog company, and then we had so many cat people. What about cats? And we're like,
what about us?
Cat people are interested. We were just pretty dog centric, and then it was like, it's much harder to get your cat to the vet. Yeah. I mean, my dog's not easy, but a lot of dogs are easy, so it's just a more pleasant experience.
Yeah.
If there's something to take them for, fine. But if you can just do this test at home. And for cats, it doesn't matter that it's got litter on it. We've tested around those.
Good,
So
good.
that doesn't impact it.
So I can understand wanting to test the cortisol level if you're worried about anxiety behaviors, chronic stress, maybe they're having some diarrhea that seems random, you can't figure out why, you want to see if perhaps it's related to stress. Can this be used at all in combination maybe with your traditional cortisol testing for endocrine disorders, or would you probably, or would you not use it for that?
Yeah, I mean, I don't know that we would use it for that just because we haven't correlated it to any
Okay.
standard. I think a lot of that is, after we do it for years, that maybe we can, establish those type of ranges, like
Right.
when you're going to see that.
Okay.
So
Yeah,
I
I mean, it
wouldn't
takes time to see a pattern and see if anything correlates. That makes sense.
Yeah, and labs are all independent. So labs have their own process. Whenever you're looking at a lab value, you should also always look at the reference range given by that lab. Because outside of really standard markers like cholesterol or LDL, most labs have their own ranges, and it's not,
Yeah.
they don't correlate with everybody
It can vary
else.
by even just a little bit too, even the 0.1 milligrams of something. So you're like, what's normal and what's not? Okay, so you guys have some amazing tests, and I'm excited actually to send these out because I've been sitting on them for a long time and I just keep forgetting to send them. So I'm very excited to send mine. How can pet parents obtain and then, I guess, perform the testing?
Yeah, you could just go online and order them. They're, direct to consumer. And so you get the test kit, you register the test kit. I mean, we can track you down if we have to, but it's easier if you register your test kit. It's the card right on the top. And then you collect the sample. If you collect the sample and it just has to go in a little tube and you can't send it right away, just put it in your freezer. Yes, I have dog poop in my freezer. So then it'll stay there for a long time and then you can just send it. So, because we say if you don't send it within the first 24 hours, just, go ahead and put it in the freezer.
Excellent.
And it's also right at your mailbox. When we were developing the test, we were trying to use, UPS or FedEx or something. It's like, I can't find that. I don't have time to get up or it's like, if we can't, and we're trying to start a company, it needs to be at our, right in my mailbox, put it in.
So regular old postal service.
Right, and just
Perfect.
put it in. And so you take the sample, you put it in a bag, you put it back in the box, and then put it in the mailer, and just send it off. And then we run every other week.
Okay.
So depending on when you hit that cycle, it could be up to 2 weeks, but depending on, when it comes in. And then you'll get an email and you get the results electronically. And the results have a summary page that says, this is what we found. And it's just like a, good, borderline, or high. And so for each of the markers that you do. And then if you scroll down, we'll give you these are the things to consider. So if you have something wrong with your gut lining, like a Zonulin, maybe some products that have, slippery elm or different herbs. If you have high calprotectants, curcumin or certain products. And we also then link to companies that we like that they're smaller companies.
Yeah.
That people are they're working on. So
good.
The brands we like, different pet foods, all different kinds, different supplements. So
Great. Well, that seems pretty straightforward and easy. Please, guys, if you get one of these, make sure you register your kit. Don't make life harder for IPL. And then it's nice because then the results will go right into your on your account, right? Your portal. It'll be will they be right in there?
And then you can in overtime you can also look at it. You can also send them right to your vet. If you get something that
cool.
So you can you can print them, you can send them as a PDF, you can just forward them on to your vet so your vet can also see them.
Perfect. All right, so then to order, you said innovativepetlab.com, and then if people want to follow you on the socials, wow, I just sounded.
Socials, yeah.
I didn't know.
You sound so young and hip.
Oh my God. What are your social handles?
Yeah, so I mean, we're mostly on Instagram at Innovative Pet Lab.
Perfect, and I will link all of that below in the show notes. Oh my gosh, Dr. Redmond, thank you so much. This was amazing. We really appreciate it. Thank you.
Yeah, I mean, and when you do your tests, call
Mm-hmm.
me back. I'm happy to go over, we can see
Sure.
what we find.
For
Yeah.
sure. Hopefully we find nothing. All good things, but
Right,
I'll
yeah.
reach out.
I mean, that's what you generally expect. Most
Yeah.
pets are fine, like most people have.
Fingers crossed in our house. But all right, I
Yeah.
will talk to you soon. I hope you have an amazing day.
Okay, thank you so much. All right, bye.
Thank you for listening. Please remember that you, yes, you, are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.